Yes, very correct. If a woman actually, like we said earlier, that early presentation has a good prognosis. For example, a woman comes in and say that, so it's unlike me. My normal period, I used to see my period like 3 days, but now I'm seeing my period for 12 days. Normally, I don't see thick blood in my blood, but now I'm seeing heavy blood in my blood. When my menstrual flow, or I can predict when I want to see my period. But before then, my period comes again. Now, that woman has presented with that complaint. It's early enough. And as a doctor, you quickly want to investigate this woman and find out why this child sudden change in her menstrual pattern. Now, I'm surprised that as a doctor, you'll be able, or as a gynecologist, you'll be able to pick that early and say, well, this man has, the reason why this woman is having heavy menstrual bleach is because she has systematic uterine fibroid. This is what I want to do to manage it. But unlike when the woman didn't come early, the woman can bleed and bleed and bleed and bleed, and that will tilt her towards anemia. Anemia is low blood level. And when she has this anemia, this could affect her heart, and she could come down with anemic heart failure. And of course, if you do not manage this heart failure because of anemia, that this man has suffered because of the incessant blood loss, God forbid, that could lead ultimately to death. So, in other words, if a woman presents early and do not delay her presentation at the hospital, it will avert the results of a severe morbidity or death, okay, with the early presentation.
Okay. Is it possible to share some real life examples where early detection could have prevented complications? For instance, last week we had Dr. Collins Abolaje last week, and we talked about fibroids last week, and he gave us examples. So when you mentioned heavy period and fibroid, I was like, oh yes, that sounded familiar because we talked about it last week. But are there real life examples that you can give us where maybe early detection prevented something, and where early detection, where the person delayed and it caused complications?
All right, thank you very much for me. Yeah, let me just be a bit practical here. In the year 1988, let's just go down a little bit memory lane. In the year 1988, in the United Kingdom, they introduced cervical screening for their females from the ages of 21 and above. Of course, we don't advise that you start before 21 years of age. Otherwise, you are going to over-treat and they are going to investigate the woman. So usually before you want to do cervical screening, the woman gets to the age of 21 years and above. So when this was introduced in the UK in 1988, they realized that for all the women that were screened, they were able to detect, it was able to reduce the chances of women developing cervical cancer for about 70%. So in other words, we have a situation where almost about 70% of women would have developed it or have a risk really of developing it. But because of that screening that was done, it was actually used to detect it early. So in other words, if you do early detection of maybe precancerous cervical changes, for example, maybe through cervical screening, whether through pap smear or HPV DNA, that is human papillomavirus DNA testing, that usually does 3 to 5 years respectively, you will be able, for example, to detect someone that is probably going to have, cervical cancer. And also for people that have infections and are actually treated, if you treat them for that, maybe sexually, for that infection, vaginal infection, and all of those things, and you're able to treat them, that will prevent them from having pelvic inflammatory disease. Because, pelvic inflammatory disease is not something every gynecologist is very comfortable with, because of the cycle it has on the woman's reproductive potential or reproductive life. So if a woman comes, for example, with what looks like an infection, the gynecologist will want to be very proactive in the treatment of that condition so that it does not lead to that, which is very inflammatory disease. So other areas that early detection can actually play a role was one I started early. In the case of fibroid, if for example, that woman has fibroid, has its own sequelae. It could affect the kidney, it could claim the life of a woman, it could lead to severe morbidity. But if it is detected early and the woman presents early enough, of course, by the prompt intervention, It will prevent the sequelae or the complications, like, for example, a woman having anemia. Anemia is just severe low blood level. It will prevent a woman from getting to that level of having severe anemia, because anemia itself, the way we classify it, any woman that has a blood level that is less than 25% is having severe anemia. And once you have a severe anemia, of course, it will affect vital organs of the body, including in heart. So if a woman eventually presents early, what looks like fibroid, and it's detected early, ultimately it will have, the doctor will, save her, developing the complications of that uterine fibroid.
Okay. I sometimes I just wonder when when we will have some breakthrough, so to speak, with women, because every time we have to talk about women issues, I'm just always discouraged, like, which day? Okay, let's talk about menstruation, which is what does a healthy menstrual cycle look like?
All right, for me, if you recall, sometimes on this program we actually talked about menstrual irregularity, where we
Yeah.
mentioned about menstrual cycle. Again, for the purpose of emphasis, we're going to talk about this morning also, because it's all about healthy woman, a woman living healthy life, particularly with a reproductive life. So it's important that we keep on sharing this knowledge on daily basis, so that at least everybody becomes informed and be
Yes.
able to take the right decision. That's what this program is all about. Now, that
Mhm.
said, we said what we mentioned the other time is that if you look at the menstrual cycle of a woman, to simplify it, we said 28 days plus or minus 7 days. Now, if you extrapolate this, if you minus 7 from 28, that will be 21. And if you add 7 to 28, that will be 35, meaning that it's supposed to be for 21 to 35 days. All right, that will be the interval that every woman is expected to see a period, all things being equal. And for the menstrual flow itself, it should flow for a period of 3 to 7 days. Yes, some can say up to 8 days. It's okay. Even if it's up to 3 to 8 days, it's okay. Now, but what you see there will not be a blood flow that will be alarming. It won't be alarming. You will know that, oh, this is my menstrual flow and this is what I started with. So it won't be alarming. To be either be mindful to all this, that you see in terms of quantity. All right. And of course, one of the things that you see in that menstrual flow is that you might tend to have this very mild, not so discomforting, abdominal pain, some of those things you on menstrual flow. And of
Hello,
course, when
Doctor.
the woman
I
is
don't know. We
menstruating,
can't hear you any longer. It's breaking.
wow.
Okay, now.
Can you hear me now?
Yes, I can hear you now. Yes.
Okay, sorry about that. So at what point did you say I could take that again? At what point?
Okay, I can hear you clearly now. Where you were talking about, I think the last time I heard it was when you said anything from 3 to 8 days is normal. Was where you I
Yes,
last.
yes. That's right. Yeah, 3 to 7 days or 3 to 8 days, and she could
Mhm.
have this mild abdominal discomfort. Now, the abdominal discomfort that she will have is not the type that will prevent her from doing her routine activities. It's not the
Okay.
type that will prevent her from going to work. So once she's having this mild abdominal cramp, wow, I think I'm menstruating and all that, that is a healthy cycle. So in other words, it is less than 35 days, it's not more than 35 days, and it's not less than 21 days. And the flow is usually 3 to 7 days, and you will have this mild discomfort that you can actually cope with, that doesn't disturb your activities. So once all of this happens, it is a healthy cycle.
Okay, that's a head. So once it's less than that, it's obviously an unhealthy cycle then.
Yeah, sure.
Anything outside the range of this is unhealthy. Okay. Now, a lot of women believe that period pain is normal. I actually do think that when when we started hearing about periods, we were told that period pain is normal. We're told, oh yeah, you feel cramps. But then at what point should period pain then become a concern?
Okay, thank you very much. If you remember, it was mentioned earlier that you could have some degree of discomfort, that it shouldn't affect your activities, prevent you from going to work in any way. That will fall under the category of a healthy cycle. Now, but when it should give you that worry, really, is when you are having this pain, and this pain is now stopping you from doing the activities that you were doing, before
Right.
the onset of that period. No, that's very disturbing, and that is very concerning. Or you now take analgesics or painkillers, analgesic that will help you address this pain.
Yeah.
And the pain, you still have the pain, in spite of the fact that you are still taking these painkillers or analgesics, the pain is not going away. Now, if you now look at this pain in retrospect, if you have a scale of 10, for example, and you know that, this pain is about 4/10, if I'm to scale this pain, but now this pain that I'm having on the scale of 10 is about 8 to 10, 8, 9, even 10 on 10 on the scale. So that means that pain is actually getting worse over time. It should be very, very disturbing to you. And now have a situation where this is even making you to start vomiting, fainting, rolling on the floor. It is very concerning that you quickly see a gynecologist at this point, because this could be a sign of endometriosis. It could be a sign of endometriosis, and that is a nightmare of every gynecologist. So it could be a sign of endometriosis, and it could be uterine fibroid also, because for those that have the what you call dysmenorrhea, dysmenorrhea is a very painful flow for women that have what's called the intramural fibroid. When they have this intramural fibroid, have heavy pain and then painful menstrual flow as well. So it could be a sign of fibroid as well, apart from endometriosis. So it's quite concerning at this point, and they have to seek for the help of a gynecologist.
Right. And if a woman bleeds, so if she bleeds very normally, if she bleeds very heavily away from what she's normal, because for some women they start bleeding heavily first 3 days or so, and then it starts easing out. So if it is heavy all through beyond normal, then it's no longer normal for her, and she should see a gynecologist immediately. Because you mentioned that why is endometriosis you were saying a nightmare, you said, or a headache for medical personnel?
Yeah, endometriosis, I just mentioned the way that it's actually the nightmare, because nightmare says that when you have a station where it should stay inside the uterine lining of the womb, that is where this tissue should stay. But by the time you now have this tissue, outside that endometrial lining, and of course, the very funny thing about it, one is actually out of the lining of the womb of a woman. Secondly, endometriosis will get to any part of the body. It can be in the lung, it can be in the liver, it can be in the brain, it can get to anywhere. Okay?
Wow.
So the question will now be, where do you start the treatment from? Do you understand? Where do you start the treatment from? So it looks like a nightmare if you look at it in the real sense, because it's everywhere by the time it starts spreading.
Wow. Okay. And I always ask this question to Dr. Ewono, and I'm asking you again. I'm going to ask you as well. At what point will the medical sector find solutions to issues plaguing women, starting from fibroids to heavy periods, endometriosis, PCOS? When will we finally, to conception, to infertility, when will we finally get a solution? Because I'm tired of hearing, this. When would there be a solution?
All right, thank you very much. Part of the solution is what we are doing this morning. You agree with me that when you have a program like this, where we are trying to give information to one another, we're sharing knowledge, and we're emphasizing the need for women to present early when they have something in their body. It's all saying that early presentation carries a good prognosis. The truth of the matter is that when you have a complaint that will make you come early to the hospital to see your doctor, consider that complaint almost completely solved or treated. But the truth of the matter is that once we give room for spread, it becomes a challenge, a dilemma in itself. So the question will not be where we start from, because now that this thing has spread to everywhere. But we can do a lot from the beginning by making sure that this does not even spread in the first place. For example, I'll give you a practical example. If someone has endometrial cancer, for example, and because of women that have endometrial cancer, it does cancer of the womb. And the majority of this woman that has endometrial cancer, the major reason why they come to the hospital is when they are seeing unusual blood. They are not comfortable. When they are not comfortable, when they start bleeding in and out, they are not comfortable. So they come to the hospital. So by the time they come early, and you notice that, oh, this endometrial cancer this woman has is just a particular part of the womb, probably less than 50% of the lining of that womb. It's less than that. Now, the ultimate treatment, if the woman has completed her family size, what I want to do for her definitively will just be to remove the womb surgically by a procedure known as hysterectomy. And that has almost, resolved that problem, largely, because she presented early and you've done that intervention, definitively by removing the womb. Imagine that a woman that has endometrial cancer didn't present at stage 1, didn't present at stage 2, didn't present at stage 3, and she's already getting to stage 4, probably 4A or 4B, where it has even gone beyond, the bowel and the bladder. It has gotten to the brain and everywhere. You now ask yourself, that where did I start from? But the same woman is probably presented early, probably in stage 1A, where a simple surgery could just be done to address the issue. You are made that will be fine, and she will have a normal life after that procedure.
Oh, wow. So what I'm hearing is, with whatever you are doing, just make sure that the moment you sense any discomfort or any abnormality, something that goes beyond what you would not typically experience, go see the gynecologist, right? That's what you're saying.
Very correct. Very correct.
Okay. So women out there, if you're listening, please, the moment you sense something, and we always sense when something is wrong. We do. Actually, as women, we always sense there's a pain you have, and you're like, this pain is very, very strange. Please go see a gynecologist. I know that a lot of us are skeptical about going to the hospital because it feels like when we go to the hospital is one thing, we come back with another. But what Dr. Ewenowo is saying, and what we always say on Radio Doctor, is the moment you sense anything, please go to the hospital. You cannot go treat yourself. And like the example that Dr. Ewenowo gave, you do not present in the first stage, second stage, third stage, fourth stage. By stage 4, we already know that it's only God at that point that can help, and the doctors can do the best that they can, but at that point is already almost too late, if not too late, for anything to be done. All right, it is 23 minutes. 47 minutes, beg your pardon, to 11. This is still Radio Doctor, and we're speaking with Dr. Ewenowo this morning on preventing gynecological problems, early warning signs that every woman must not ignore. Okay, now, Dr. Ewenowo, vaginal discharge is common, but how can a woman differentiate between normal vaginal discharge and infection?
All right, thank you very much. Yes, vaginal discharge, yes, is actually one of the presentations that we see at the gynecological clinic, like was said earlier. Now, but there's a distinction between normal vaginal discharge and one that's an effective one due to infection. Now, usually for the normal vaginal discharge, you start by looking at the discharge that is coming out. Usually, what the discharge for a normal vaginal discharge is usually a clear one. Okay. It's usually clear. It might look something whitish, but in the recent is actually clear. Usually, it does not come with any odor. It doesn't come with any odor, and by the time you even ask the woman 1 or 2 questions, the woman will tell you that there is no associated inching. It's not inching her, and she's not having any pain with it. So, in other words, the things that I want to find out about that discharge is that pain? Is there itching? Does it come with odor? And what is the color? These are the questions you want to ask. Now, for the one that is due to effective process, okay, so now let's move away from the normal, because it's important for us to first know what the normal looks like before we now move to infection. So, if you that have infection, what are those things that you probably you want to see? The one that has infection, usually it will have odor. Okay, the odor could be somehow offensive. It could be offensive. You could have offensive odor with it. And if you look at it, remember we talked about for the normal one, we're looking at clear and all that. Now, for the one that is due to infection, it must come with a color. It usually comes with a color. It can be green. It can even be yellow. It comes with that kind of color. Okay, and it can be so thick also. When you know your glove finger, you look at it after your examination, you could see that what you are feeling in terms of is something that is actually thick. But more importantly, the girl will have itching. You want to complain about itching, okay, and she will equally complain about pain. In fact, she will even tell you also that maybe during intercourse also she's having this this painful intercourse, she's having pain here and there. So that will tell you that we most likely will deal with infection. So in other words, so for the one that is due to infection, you look at the color, it can be yellow, it can be green, it comes with odor, it itches the woman, and it comes with pain also. These are the features you see with an effective one, different from the normal vaginal discharge.
Okay, thank you so much for that answer, Dr. Winono. So when should a woman, I mean, we've said that if you see that something is abnormal, go. But then how can this untreated infection, how can it affect fertility in the long term? Because obviously, if the woman doesn't come to the hospital, it will remain untreated. Some women just think, oh, let me take herbal medicine to cleanse to cleanse your system. That's what a lot of women say, oh, drink agbo, drink this or drink that. But what happens if it is untreated, and how does it affect fertility in the long run?
Yeah, thank you very much. For us gynecologists, for every woman that we see, for example, that we are always ahead of time. The reason why we're ahead of time is that we're very passionate about the fertility of every woman. So every gynecologist is very passionate about the fertility of every woman. So once a woman has infection, for example, you already start looking ahead. What could be the likely complications or sequelae of this medical condition, of this condition? That is what you have at the back of your mind as the gynecologist. So if you have infections that's actually untreated, you must understand the anatomy of the female in terms of their reproductive organ. You have the uterus, you have the fallopian, and you have the ovaries. All of this play a very important role in the reproductive potential or the reproductive life of a woman. So these organs must remain anatomically okay at all times. Now, one of the things that infection can do is to actually damage the fallopian tubes. And what's the fallopian tube? The fallopian tube is that part of the reproductive organ where a healthy sperm and a healthy ovum actually meet, get fertilized, and then form the embryo before eventually gets to the womb for implantation and start growing from there. Now, but where you now have the situation where the fallopian tubes have now been damaged by that infection. Now, it could damage it in so many ways. One, it damaged it to the extent that the movement that allows, the peristaltic movement that allows the egg to move, that pick the egg and move it towards the sperm to get fertilized, that anatomical function is affected because of the damage to the fallopian tube. That is one. And secondly, it can also ultimately lead to the fallopian tubes being blocked. Now, when the fallopian tube is damaged, one of the things that I can have is that once it's damaged, it does not mean that maybe it's blocked, for example, or it's blocked, it's damaged, and that can affect the anatomical function of that organ. Now, once that function is affected, if the sperm now fertilize the egg in the fallopian tube, because of the damage to that fallopian tube, that fertilized egg can get trapped inside the fallopian tube. And once it's trapped inside the fallopian tube, so that means the woman already have an ectopic pregnancy. An ectopic pregnancy is a pregnancy that is outside the endometrial lining. That is the uterus. So any pregnancy outside the endometrial lining is ectopic pregnancy. And the commonest ectopic pregnancy, more than 95%, is actually seen in the fallopian tube. So if an infection has reached the fallopian tube, for example, and the egg, the sperm now fertilizes the egg in fallopian tube, it may not be able to leave that place where fertilization takes place. And it should just get trapped there. That's ectopic pregnancy. That is why. The other thing that could happen is that the woman can actually come down with infertility, inability to actually conceive. Okay. Now the implication is that that's supposed to be, the fallopian tube is supposed to be a meeting point between the healthy sperm and the healthy ovum. But when the place is blocked, so that means there's no meeting point for them. So that means there's no way the healthy sperm can ever come in contact with an healthy ovum. So the woman will have difficulties at getting pregnant. So for this woman, we say, oh, this is a woman that has a tuber factor for infertility. And now to resort to in vitro fertilization and all of those things. So if an infection is not treated and it continues with the damage to the fallopian tube, it can predispose a woman to having a ectopic pregnancy and can actually make a woman not to actually conceive by making her to have tuber factors.
Hey. Okay. Wow. Okay. My next question is this. Again, we're live on YouTube at WFM917.com. At WFM917. You can listen to us on the go, www.wfm917.com. I think I'm just reeling from the information I'm getting today, because you're just like, what's going on? How can we win? How can we win as women? What about self-medication, Dr. Wonomo? Because this is something that we do as Nigerians, regardless of the stage in life that we're in, whether it is something minor, whether it's something major. Actually, you don't even know which one is major, which one is minor, because you're not qualified to even give yourself, that is it, the prescription, the drug. But what about self-medication? How does that affect gynecological problems? Does it make it worse?
All right, thank you very much. From yes, it does. Let's break it down again for us to just be on the same page. Now, remember, one of the reasons why a woman can have delay, for her to present at the gynecological clinic is when she resort to self-medications. That's a problem in itself. That's one. Secondly, now, gynecologists, how do we operate? How do we operate as gynecologists? Now, a patient will complain that, oh, I'm having vaginal discharge. That is the symptom. A doctor will examine her and pick one or two things. That is the sign. A doctor will now do investigations based on the complaint of the patient, the symptom, some findings as a doctor, which is a sign. The result of the investigation will now come out, and the treatment will be based on all these three put together. In other words, the complaint of the patient, the symptom, the findings of the doctor, the science, the results of the investigation done, and then treatment proper. And now, in a situation where a patient, for example, has maybe severe abdominal pain, and the has probably got to take maybe herbal preparations or gotten some antibiotics or analgesics across the counter, and this will now mask the symptom of this patient. Now, if the symptom here means the complaint of the patient to the doctor. Now, once this is masked, remember what the doctor is going to investigate is the complaint. And the doctor has not been able to, get any information from this patient with respect to what to even examine or what to even investigate going forward. So the doctor will not just, with the little information he has, or the gynecologist has, with the little information he or she has, is what he's going to work with. Because the drawback here is that the real complaint that this patient should have come down with has actually been masked or overshadowed with the other concussions or the pills she got across the counter, thereby not presenting properly to the doctor, what he or she should tell the doctor. And as a result of that, it's just a question of time. The condition is going to progress, it's going to get worse. And when it gets worse over time, this will lead to some complications that would have been detected early if she has not resorted to self-medications, from quacks, or where he or she shouldn't have, where he or she should not have, procured that from. Self-medication in itself is damaging, is disastrous, and of course, it can pave way for complications to set in.
Okay, just to go back to the fibroids, you mentioned fibroids earlier. How can a woman know if she might have fibroids without doing the scan?
Okay, yeah. The truth of the matter is that if you look at fibroid, is the most common benign, tumor, in women, particularly women of reproductive age, that is seen in the womb. Really, it's a very common tumor. And if you look at it women of reproductive age, about 30 to 50% of them have this fibroid, and of course, more than 50% of them, they may not come down with any of this. They may not come down with any symptoms. So other ones we say, so that means if you're going to pick it, for example, it could just be an incidental from this, for example. However, for those that are less than 50%, they will still have one complaint or the other. So those that will have complaints are the ones that, so emphasis here is the one that we're looking at. So what are the common symptoms that they may have with? Now, majority of these women, you will have heavy menstrual bleeding, okay? Because fibroid is one of the leading causes of heavy menstrual bleed. A woman that is bleeding maybe for 3 days, 5 days before is not bleeding for a month. It's not bleeding for 3 weeks. All right. So once a woman notices this kind of, pattern of menstrual bleed, that her period is now becoming very heavy in the number of days and even having thick blood in it, that is heavy menstrual bleeds, what we refer to as HMB. It could be a sign of fibroid. Once a woman is having, heaviness or fullness in her lower abdomen, and she's not pregnant, and she's feeling this unusual heaviness, in the lower part of her abdomen, this is in keeping. This may be suggestive also of uterine fibroid. Other things could be that there is this relationship between the uterus and the bladder. The bladder is the temporary tank where the urine is stored before everyone goes to urinate. So because of that anatomical relationship between the uterus where the fibroid is located and the bladder that is right on top of it, so the fibroid can actually cause an irritation of the bladder that is on top of it, thereby making the woman to urinate a couple of times. So the woman could be urinating frequently as a result of irritation coming from the bladder that is behind the bladder. Sometimes it could be that the woman might say, she has difficulty at getting pregnant, she's wife, sometimes she's not conceiving and all of those things. By the time she has one of this complaint, she comes to the hospital, this would just be those symptoms that are suggestive of fibroid. Because by the time we now investigate, we now realize that the woman has a uterine fibroid. So this would be some of the symptoms that she will come down with, either having heavy menstrual bleed, fullness or discomfort or heaviness in her lower abdomen, urinating frequently, or because she are getting pregnant. All of this will be suggestive of fibroids.
Thank you so much, Dr. Iwanowa, for today's session on preventing gynecological problems, early warning signs every woman must not ignore. Dr. Iwanowa has, really broken it down for us, like things that you should not ignore. And just to reiterate, he has said that if you feel any form, or if you see any form of discomfort, if you see anything that's not normal, please run to the hospital to speak to your doctor or gynecologist, so that it will not turn into minor, will not turn into majority. So if there's anything that you take from him, he keeps on saying you have to listen to your body and then go to the hospital. Go to the hospital so that they can check you out. And he had said if they check you out on time, things will be favorable for you. If not, yeah. Okay. Dr. Iwanowa, thank you so much for coming on today's edition of Radio Doctor. We truly appreciate you.
Yeah. Thank you very much for having me. Thank you so much.
Yes, Dr. Iwanowa is a senior registrar in obstetrics and gynecology at Lagos Island Maternity Hospital. He's also the first vice chairman, Nigeria Medical Association. Thank you so much, Dr. Iwanowa. Radio Doctor is broadcast Mondays through Fridays, 10 a.m. See you tomorrow for our next edition of Radio Doctor. Many thanks to our producer, Aisha Sani, and Benjamin in the studio, and Rachel, and the executive producer, Tonwoke Wale Shanaya. My name is Fumi Bangala. Remember that you should have a healthy day. Bye for now.
Yeah, bye.